Let's talk about this now. Dr. Lisa Masterson, she specializes in obstetrics, gynecology, and infertility, and also Dr. Anita Gupta, a leader in the field of anesthesiology and pain medicine. She treats women who have the same surgery that Angelina Jolie underwent. Thank you, doctors, for joining me this evening. May I call you Dr. Lisa? I want to go to you first. Everyone on the doctors called you Dr. Lisa, so I'll call you Dr. Lisa. Your mother died of breast cancer, so this story is really close to you, close to your heart. What was your reaction when you heard this latest announcement?
Well, as a physician, I thought it was really good that she sort of went back and explained why she did everything, because again, this is her decision, and I think we very much have to respect women's decisions based on their history, their family history, their experiences, and every woman's going to make a different decision. But again, we have to respect a woman's decision. Now, as a physician, I think there are other alternatives to go to. But also, as a woman who did have a mother who died of breast cancer, I may do something completely opposite of what Angelina Jolie did. But what I think we have to guard against is what they've started to call the Angelina Jolie effect, and doing something just because a movie star did it. It has to be your individual decision, because there's a lot of decisions out there to be made, and women need to be guided through them.
Dr. Gupta, I understand that you said that you think it brings awareness, but you're also concerned and you caution people to consider at least a negative side of taking this, what you call an extreme measure.
Absolutely. I have patients in my own practice that deal with chronic pain after such surgeries, and what happens in these patients is that they have debilitating pain, they end up living with pain that can often lead to prescription drug use that, as you know, has serious consequences. By all means, I agree with her decision. But there are serious consequences related to invasive surgery that need to be understood by patients, and informed consent needs to be in place, and physicians and patients need to be fully aware that these surgeries cannot be taken lightly, and is certainly a personal decision.
Okay, so what are the alternatives? Let's talk a little bit more. Dr. Lisa, you mentioned some of them, so that you don't have to possibly, go this route of surgery. What would you recommend to your patients?
Well, people
right?
minimize, yes, people minimize lifestyle choices as far as exercising, decreasing alcohol in their lifestyle, making sure they have a really healthy diet full of fruits and vegetables. But also there's medications that they can take, selective estrogen receptor modulators that can actually help to decrease their risk of breast cancer as well. And I don't think women are given that information, that they don't have to do something as drastic as altering their bodies, just like Dr. Gupta says, and maybe regretting those decisions afterwards, or not even taking menopause seriously, because that even though those symptoms can seem very minor, they can affect a whole woman's sexual esteem, her self-esteem, and they're very, very important. I think, Angelina Jolie has made an educated decision, but it's important that women know all of their options, and all of these things that seem to be, taken so lightly. A mastectomy, again, not just with the pain, but also you may not get the breasts that you like afterwards in the reconstructive surgery. So it's very, very important that women weigh all of the information and do what Angelina said in her op-ed piece, is make an informed decision, get the East-Western medicine, all of your options, and do what's right for you. And I think that's what she's trying to say.
I want to ask Dr. Gupta this, because some wonder if the procedure was even necessary, because it showed that this latest procedure showed that there was a small benign tumor on one ovary, but no signs of cancer in any of the tissues with her procedure. Was it even necessary, Dr. Gupta?
So these surgeries absolutely may be necessary in particular individuals, but when there's a benign tumor there, even the surgical procedure in itself has much controversy right now. As you may know, the laparoscopic approach to this surgery currently has significant risk related to it, and the FDA is examining the products that are being used for that procedure. And that in itself is a controversy. And in addition to that, the massive open procedure that's related to this, the recovery for that can be tremendous. And certainly those conversations need to occur before surgery. I all too often have to deal with these patients after surgery that have uncontrolled pain, require extensive hospitalization, and require amounts of medications that can sometimes be astronomical.
Yeah. Let's talk about elective surgeries, right? And because there are inherent risks with that. We saw with Joan Rivers, who went in for an elective surgery. Angelina Jolie is younger when she died from a surgery. what should women weigh, Dr. Lisa, before having an elective surgery?
Oh, definitely they should weigh the risks and make sure that the benefits outweigh the risk, because you undergo general anesthesia, you can risk injury to adjacent organs like bowel and bladder and things like that, so you can hemorrhage and require transfusion. So there are real risks to surgery. So when it's an elective, you have to really make sure that the risks very much outweigh the benefits.
Dr. Lisa,
the benefits outweigh
Dr. Gupta,
the risks.
yes, we understand. Thank you very much. We appreciate both of you joining us this
Thank
evening.
you very much.
We'll be right back.